Hello, everyone. Hello, welcome, welcome, welcome. Welcome to Dr. Mercy, Q&A with Dr. Mercy. How's everyone doing? Hope you guys are having a wonderful evening. Uh, Happy Friday. Hope you guys are enjoying your day. Welcome, welcome. Hello, this is Q&A with Dr. Mercy. I am Dr. Mercy, and we're going to have another wonderful episode. With this episode, we're going to talk about breast cancer. This is going to be the last part series of our series on breast cancer. But before we talk about breast cancer, just wanted to know, where are you guys viewing me from? What cities are you viewing me from? If you can, just jot it down in the comment section. Um, Hello, happy Friday to you too. Hi, Arlene. How are you doing? Gustav, I'm sorry if I mispronounced your name, but how are you? From Norway. Wow, that's far, but awesome. Thanks for being here. Happy Friday night to all and to you as well. So thank you guys for coming in. Hi, Kathleen. You're viewing us from NYC. Awesome. Emma from New Jersey. Okay. New Orleans is in the house. So is Austin, Texas. That's awesome. And another New York, New York. Well, thank you guys for joining. Again, this is going to be a wonderful talk. It is about breast cancer. As you guys know, we have been talking about breast cancer this whole month because this whole month is Breast Cancer Awareness Month. And the last 3 weeks, we actually were kind of viewing an interview that was done with Dr. David Ajabadi, who is the CEO of Brain and Body Foundation. He had done an interview with a breast cancer person who has breast cancer, and she was talking about her experience of how she was diagnosed and how she did certain lifestyle changes, and after she did these changes, how she noticed a significant improvement in her just her stamina, a significant improvement in her treatment, and in just the whole overall prognosis that she had. So if you guys have not seen those videos, it's part one and part two. If you haven't seen it, I would go back and just view them on the BWE platform, the Black Women Empowerment Platform. It is really empowering. I mean, just the way she's just so positive, even though she had a very devastating diagnosis. And on top of that, her mother also died of breast cancer. But that does not stop her. She is going in faith, talking about how, having positive thinking, having positive emotions, and eating healthy, how that has helped her a lot in this journey of breast cancer. So, again, if you have not seen those two-part series, I would suggest going back to the previous videos and just viewing them. During those videos, though, I did ask if there was any questions about breast cancer. Make sure you jot them down in the comment section. I went and I reviewed all the videos. I did not see any questions. That's okay. If you still have any questions about breast cancer, please make sure you jot them down in the comment section, and we can discuss them and I can go over them. Okay. But I also said, like I said last week, this week is going to be the final week that we talk about breast cancer. And I wanted to talk more about, okay, how do you get diagnosed with breast cancer and what is the management of breast cancer? So I did make a slide so that you guys can also visualize what I'm saying. So I'm going to put up the slideshow up on the screen. So bear with me. And we're going to, yes, and then we're just going to discuss what exactly the diagnosis, what's the management. If you have any questions, again, feel free to jot them down in the comment section. So breast cancer, as you guys all know, it's the most common female cancer in the United States, but it is not just limited to females. Men can have it too. And the most common or the most famous male who had breast cancer was not most, but you guys are aware of him. It's um, Dr. Knowles, who happens to be Beyonce's dad. He had a diagnosis of breast cancer. And if you look at the BWE platform, the Black Women Empowerment platform, you will see videos of him talking about his history of breast cancer and also being interviewed by Dr. Oz. So is everyone able to hear me? Can you hear me? I just want to make sure. Keisha's talking about there being static. Are you able to hear me? Please let me know in the comment section. Are you hearing static? Can you hear me? Is it clear? Can you put clear or put static on the comment section so I can be aware? Am I clear to you? Oh, really? Wow. I wonder why. There's static. I don't know why you're hearing static. Just one moment. Let me see. It's not clear. Static. I hear static also. Okay. Why are we hearing static? That is very interesting. Oh, just one moment. Maybe if I remove. Can you hear me? Can you hear me? Can you hear me? Can you hear me? Can you hear me, everyone? Okay. All right. I'm going to continue if that's okay. Okay. So breast cancer is the most common cause of cancer death in women, particularly after lung cancer. And remember, in Black women, it's higher in Black women than in other races. Thank you, Sherry. I will continue. Particularly the most aggressive form of breast cancer, which is the triple negative. As I've said in the previous, I will continue. Thank you, Keisha. As I said in the previous, and I'll try to figure out why it's static. I think it's because it's the phone and the laptop close by, but I will continue. Thank you. As I said earlier, in previous videos, American Cancer Society suggests that all women between 40 to 42 before 45, really consider starting your mammogram. It's a consideration, but you don't have to do it. Definitely after 45, they definitely do want you to actually start having your mammograms. And we'll talk more about mammograms in future slides. So screening is the best way to detect early stages of breast cancer. Screening is the best way, okay? You may not have the bump or the lumps or any of that in your breast. Your breast may look normal, and that's why mammogram screening is the best way to detect it where it's at a stage that it can be possibly to the point of you not getting it back. So that's why screening is always so important. So what are some of the signs of breast cancer? Well, you start seeing lumps. You can see lumps in your breast. You can see changes in your, changes, dimpling of the skin. So changes of the skin texture. And dimpling of the skin, it kind of looks like an orange. You see how the orange, how it has like little like bumps on it, like little like holes kind of. It's not completely smooth. It has like little ridges in it. That's how, when you say dimpling of the breast skin, that's exactly what it is. Also, you can see changes in the actual size of the breast. So one breast is larger than the other. You can see changes in the color. One may look red compared to the other. You can also see, sometimes you can see your nipples. You know how your nipples protrude out? Well, sometimes with breast cancer, your nipples are just protruding inward. And that's called nipple retraction, when the nipples protrude inward into your body instead of out. And that can be seen in breast cancer as well. And then you can also have abnormal nipple discharge, like bloody discharge, things of that nature. And I remember Dr. Knowles, when I heard his story, he found out he had breast cancer because he was seeing bloody discharge coming from his breast that was on his bed sheets. And his wife also noticed that as well. And that's when he decided to go and get checked. So these are the different signs. Now, keep in mind, these signs, just because you have a lump, or you may even, one breast may be larger than the other, or you may have some changes in your breast, just because you see those changes, don't freak out, because not all of those changes are related to breast cancer. A lot of them can be other conditions that are very benign and that come and go, or that may require antibiotics. So just because you see these signs does not confirm that you actually have breast cancer. You just need to go and get it checked. Okay. I'm going to go to the next slide. So this is how a mammogram looks like. And like I said, mammogram is the #1 screening test for breast cancer. So as you can see here on the right, you see a woman, and she's actually getting her mammogram done. And that's when they place the breast onto a plate of this x-ray machine. It's actually an x-ray machine. And then that x-ray machine just kind of compresses the breast and lightly compresses it, and then takes a picture. And then right on the left, you see the picture, and it looks kind of like an x-ray, right? So and these x-rays will now, the radiologist can now view it and kind of look for little spots that can signify cancer. So this is an example of a mammogram that was taken. Very quick, you're in and out. So it's not as daunting as it may seem. It's a very quick test. And but there are other tests that can be used for looking more into the breast. And the second one is a breast ultrasound. So a lot of times doctors may order this ultrasound of your breast to kind of look further. If you tell them like, hey, doctor, I have a lump on my breast. I want to know, like, could this be cancer? They may order a mammogram to kind of look at it from an x-ray perspective, but they'll also order an ultrasound. So depending on the ultrasound will show whether or not this is a solid mass or if it's just full of fluid. A lot of times, if it's just full of fluid, it may just be a cyst, and very benign cyst. And a lot of times with us women, we can have cysts that comes and goes, and it's really nothing to write home about. Or maybe fluid filled, like an infection where you have to get antibiotics, things of that nature. So I just want to let you know that not everything that's in the breast is due to cancer. There are other causes of it. If they are concerned about a cancer, they may also order a breast MRI. They'll order that to kind of look even further into the breast. And a lot of times they may even still order it in the screening phase. What you mean by that? Well, some of us have very dense breasts, okay? And as you can see in this picture of the mammogram, if you have dense breasts, it's going to be very difficult for the radiologist to actually view the breast because your breasts are so dense, right? So they may want to just go after looking at your mammogram and saying, these breasts is just so much tissue in it. They may just suggest you getting a breast MRI. And again, they just want to make sure that through all that tissue, there's no form of breast cancer, okay? So don't get freaked out if your doctors do recommend a breast MRI. And obviously they'll ask to let you know. If they don't, ask them, okay, why am I getting the breast MRI? Why am I getting the breast ultrasound? They will be happy to explain to you, okay? So what are the different types of breast cancer? Well, there's two major categories. I'm not going to go in depth with all the different types of breast cancers. I just want you to be familiar with the two major categories, okay? So the first category is the in situ breast cancer. So it kind of describes what it is. In situ means it's within breast cancer. So it's very contained, it's very localized. Sometimes it's a ductal in situ. So what that means is, I'm going to go over here. If you look at the purple in the purple in the breast over there, this is the ducts, okay? These ducts, this purple kind of circular, looks like ducts, really, a circular, circular areas that are purple. These are the ducts, and these are the mammillary ducts. This is where the milk is stored and where they come out from the breast into the nipple, okay? So sometimes you can get breast cancer within these ducts. And if the breast cancer stays within that ducts, then that is called in situ breast cancer, okay? The second type, which I didn't put over there, and I don't know why, the second type is, and so the in situ breast cancer is it's a less aggressive breast cancer, and it can be treatable if it's caught early. And a lot of times what you just do, and this is the lumps right here, this is the same duct that I was showing you over on the other side. I'll go back to that slide. So what you would do is that duct, you can remove that duct or some breast tissues around that area, or you can do a whole removal of the breast, or you can do a partial removal of the breast. It's all dependent on the oncologist and also on the surgeons. They want to get all the cancer out, so they may go a little bit further beyond where the cancer zone is to ensure that all breast cancer is taken out. Can you hear me? Somebody said, is it over? It's not over. No sound. Can you hear me? I am going to, so I may just have to re-record this again so that those who want to see it on a playback can be able to see it. I am so sorry. If you can't hear me, I will look at it on playback. If there's no sound, I will definitely record this and upload it so that you guys can see it better. I'm sorry. So anyways, I'm going to continue on for those who can see me. Thank you so much. Loud and static, but yes. Okay, thank you. I will likely record this so that it's more clear. I am so sorry for this. So anyways, getting back. So the inside too. So there can be treatable. You can do just a simple lump. You can do the whole partial breast. You can do the whole breast. But after that, then you do radiation. And why do they do radiation? They do radiation to kill any invisible to the eye cancer tissue that and prevent any underlying like cancers that are about to grow, cancer tissues that are about to grow. So they do that so that they get everything. And if you have the ductal inside two breast cancer or a breast cancer that has inside two, like I said, it's very favorable. Okay. And the likelihood of you having a reoccurrence is lower than some forms of breast cancer. Now, they may, once they take the breast cancer, no problem, Keisha. Thank you so much for the help as well. They take the breast cancer out, they're going to send it to the lab. And when they send it to the lab, they're going to analyze it. And they're going to analyze the actual cells to see if they have what they call receptors. And what are receptors? Receptors are just kind of like, how should I say this in layman's terms? It's kind of like a spot on the surface of the cell that if you put something on that spot, it will open up the cell or it will block the cell. Okay, so it's a receptor. So there are three receptors that they look for, and it's very important in breast cancer. They look for receptors that are responsive to estrogen, which is a hormone in your body, receptors that are responsive to progesterone, which is another hormone in your body, and this other receptor called a HER2. It is another receptor on the cell of the breast cancer that that is a protein that the body makes. Okay, if the cancer has those type of receptors, so let's say it has estrogen receptor, the it's going to be a great favorable thing. Why? Because we have certain medications that attach to that receptor and pretty much block that cancer from growing. So if it has an estrogen receptor, if it has a progesterone receptor, if it even has a HER2 receptor, we are happy because we have medications that we can give you that can block that cancer from growing. So they will. So when they talk about her receptor, PR receptor, HER2 receptor, receptor, PR, and HER2. Those are what they're referring to. But another form of cancer beyond the inside two, moving forward, is the invasive breast cancer. So now this cancer is no longer just in the ducts. As you can see on that right side, you see that there are one, two, three, 5 different circular things at the bottom, and these all show how the ducts or the mammillary ducts look like. That third circle at the bottom, that is still the cancer. Those I guess those really dark circles within that big circle, that's the cancer as it is located in the actual duct. So as you can see, that third circle, the cancer is there, but it is within the duct. Now, the fourth circle, you can see the cancer getting out of the duct and moving out. And that is where you start talking about invasive breast cancer. It's when it moves from the ducts and it goes into the surrounding breast tissue. Now, and this is where you're now talking about the more aggressive breast cancer. And in this stage, you're looking at, okay, thinking about not only possible removal of the breast, you're also thinking of not only possible radiation, but you're thinking of, okay, how aggressive is this breast cancer? So this is where the form triple negative breast cancer is. Remember, I told you about the receptors and how there are certain receptors on the breast cells. If they're positive for any of these hormonal receptors, that's good news because we have medications that can block those receptors. But if they're all negative, then that's bad news because why? We won't have any medications that can block the receptors on that cell, and therefore that cell will continue to what? Grow and grow and grow. And cells that don't have an estrogen receptor, cells that don't have a progesterone receptor, and cells that don't have the HER2, these breast cells, breast cancer cells that don't have it, you call them triple negative breast cancer. And remember, I told you, and I've been saying since the beginning of this month, triple negative breast cancer is very, very common in the Black population. And because it's triple negative, they're not responsive to the estrogen blocking medications or the progesterone blocking medications or the HER2 blocking medications, and therefore they're more aggressive because nothing can stop them. So sometimes what they would do is they can try chemotherapy, but if they start growing and growing and get beyond the and get beyond the breast to other organ systems, there is a less likelihood that someone can get cured from breast cancer. So that is essentially my talk on breast cancer. I know it was just a general overview, but this gives you kind of a taste of the signs and symptoms rather, and then also the different types of breast cancer, as well as what are some of the treatments out there. Um, Definitely, I think out of everything, if the moral of the story is one, get screening, get screening, get screening, because the earlier you detect it, the earlier you can get cured from it, the higher that you can have a chance where it does not reoccur. That's one. Two, if you see any changes in your breast, doesn't matter what it is, get tested. Doesn't matter how old you are, get tested, get tested, get tested, get screened, get tested. And then three, there are different types. So just because you are diagnosed with breast cancer, there are some types that are just local, and those local ones can be easily treated. And then there's the more invasive ones. But even with the invasive ones, there are different options as well. So it's best to just talk to your doctor and they can guide you through this experience. So that's it when it comes to breast cancer. I thank you guys. I am so sorry for this technical difficulties. I will replay it back, and if it is not sounding well, I will redo the video and upload it. Okay. If no one has any questions, if you do have questions, please make sure to jot it down in the comment section. If you don't, that's fine. I hope you guys have a wonderful rest of your evening and have a good day. Bye. Thank you, Sherry. I appreciate it. Have a good day. Thank you. Bye.